Welcome, everybody. My name is Alan Higgins. I'm the Health Equity Network lead, and welcome to the monthly webinar. And today, we're delighted to have the Mayoral Regions Programme with us. And in a few moments, we'll get underway with our speakers. Just a few housekeeping rules. If you can, keep yourself on mute until you get to the point where you're invited to ask a question or make a comment, then that would be really helpful. It's always quite nice for us to see people. If you are able to turn your camera on, then that's lovely too. If not, then that's fine as well. The webinar is being recorded. We will then put an edited version of the webinar up on the Health Equity Network afterwards. And I think that's possibly all the housekeeping I need to do. So the Mayoral Regions Programme has been working for some time, looking at what combined authorities can do on public health, and particularly addressing health equity, inequalities and health issues. It's becoming even more important as we move into this year, when we've got the English devolution bill coming up in the next parliamentary session. And you'll know that strategic authorities are going to have even more responsibilities around health and wellbeing and health equity as well. So it's a very interesting area of work. And today we've got Alice Walker and Tom Gancox from the Mayoral Regions Programme, who are going to go through some slides about the newly developed Health and All Policies Toolkit, which is a suite of tools designed to help the vital role of mayoral powers in improving population health. So very much looking forward to that. And then we'll have Mubashir Ajaz, who's working as part of the West Midlands Combined Authority. And when Jen manages to join us, we'll have Janet Connolly from West Yorkshire Combined Authority, will be giving us their views too about the HiAP programme. And then we will turn it over for questions and comments. And at that point, Grace Scrivens from the Mayoral Regions Programme will join us as well. You can post your comments and questions into the chat as we go along. I'll try to highlight some of those and then come back to you afterwards. And we'll pick up the discussion from there. So just noting some of the comments about sound. Generally, if it's working for most people, then it might be something that you might need to do at your end just to either rejoin or find another way of looking at the sound issues, but I hope that gets resolved for you. In which case, I will now hand over to Alice from the Mayoral Regions Programme, who will take us through the start of the presentation. Alice.
Thanks, Ellen. Hi, everybody. I assume everyone can hear me unless I see something in the chat. So I'm going to start off by I'm just going to request control of the slides. I am part of the Mayoral Regions Central Policy team along with Grace and Tom, and I'll just run you through what we're going to talk about today. So I'm going to give you a bit of background on the programme, why we're focusing on health and our policies and why this toolkit, and I'm going to hand over to Tom to run through the toolkit, and then we're going to have some reflections from Mubashir in West Midlands and Jen in West Yorkshire Combined Authorities on how the tool's been used or will be used in their regions. So the programme background. So this is a programme that's funded by the Health Foundation that's running with the money being given to the West Midlands Combined Authority. So Mubashir leads the programme, and the aims of the programme are actually written on the next slide, so I'll go there. I should also say that these combined authorities that are depicted on this slide, these are all part of our governance board. So it's led from West Midlands, but we have representation from most of the mayoral regional authorities on our governance board. So aims of the programme are really to understand how regions can use their wider powers that kind of largely relate to the wider determinants of health and capitalise on those levers and powers to address social and health inequalities and improve health overall. So recognising that lots of things are happening in different places, how can we consolidate and share that knowledge and learning? So the model is really around peer learning, extending the evidence base, and also providing a bit of extra capacities within combined authorities to prioritise work on addressing health inequalities. So next, why a focus on HiAP? So I should say at the beginning that we're using the word HiAP because that's the word that the WHO used, but we actually realise that in different places it might not be called health and all policy. So really what we're talking about is using powers relating to the wider determinants of health to improve health outcomes. So that might be HiAP might kind of be the word that has political currency in one place, but not necessarily in other places. But I think the kind of central themes and the kind of learning is really generalizable. So the importance of this for regional level is, as I said, there are lots of powers relating to the wider determinants of health that are held at national level and local level, but also at regional levels. So thinking about things like policing, crime, safety, transport, housing, lots of these levers we can then think about how can we maximise the potential of addressing health inequalities through capitalising on those at regional level. And the request to create a kind of framework to support, or a toolkit to support learning and to support action on these areas in different CAs came from the West Midlands Combined Authority and the West Yorkshire Combined Authority. And that's why we've created this resource. So I'll just go into a bit about how we did that and also what it is. I suppose just stating up front that the challenge for creating a resource that's aimed for use in lots of different regions, and those different regions have different powers, so some of them allow different devolved powers and functions according to local devolution arrangements. There'll also be different capacity and political appetite to work on these kind of issues, so we've tried to make the tool really flexible, and for that reason we've designed it kind of in 4 parts. The methods of the how we made the tool was we looked at lots of different learning and case studies from different regions and tried to think about a framework through which we could kind of create something that was a generalizable resource. So we came up with a kind of maturity model. So you can see that there's 4 parts of the tool. So kind of we're thinking about a kind of almost like a Maslow's hierarchy of needs kind of model. So at the base level, what are the kind of structural organizational enablers to promote and support HiAP working in a region? The next part 2, is about specific opportunities for action. So thinking about specific policy areas like transport or policing or air quality. How can those what are examples of those and how are they done? Part 3 is about developing strategy, so thinking about what kind of local capacity and mandate is and how that affects what kind of HiAP intervention you might do, so more of an organisational approach or more of a kind of policy area specific approach. And then part 4 is about capturing progress, so really monitoring and evaluating HiAP efforts. And you'll see the 2 things on the side of this pyramid. So we've got part 1 comes with an audit. So organisations can then audit what kind of enablers they have, and that kind of a bit kind of assets-based approach. What should they be working on? What can they build on in terms of their organisational assets? And then we've got this activity prioritisation tool, which relates to part 2. So when you see all these opportunity for actions, there are loads of them, and we've created a kind of prioritisation framework so organisations can use that to think about what might they want to prioritise now, given their population need, given their local capacity, given their mandate, given the policy windows, and how can they progress this further. So that's a kind of quick overview, but I'm going to hand over to Tom now, who's going to go into the toolkit in more detail and explain these parts in a bit more detail. So I'll hand back over to Tom.
Thank you, Alice. Hi, everyone. I'm Tom Dancox, a policy officer for the Mayoral Regions Programme. I'll be doing just a quick run through of the different parts of our HiAP toolkit. Starting with part 1, the pillars for HiAP, which looks at 5 key structural and organisational aspects that form the basis of any successful HiAP approach. And these are cross-sector partnership working, so working across government departments and teams to capitalise on HiAP opportunities, shared strategic aims by encouraging action from different sectors within the regional authority and with wider system partners, and then leadership, so effective leadership is crucial in advancing HiAP within mayoral regional authorities, and governance and accountability, the formal processes and procedures that enable the systematic embedding of health across mayoral regional authority policy and programme levers. And then finally, monitoring and evaluation. So effective evaluation to guide processes and measure outcomes ensures that HiAP gains and retains traction over time. These are accompanied by a number of enabling factors, common barriers, as well as case study examples of how each pillar has been strengthened in a mayoral region. So if we take a look at one of the pillars, leadership for HiAP draws from 3 sources. This is a political mandate from the mayor or deputy mayor, building leadership for HiAP amongst leaders from different sectors in the 1st, 2nd and 3rd tiers of an organisation, and then also catalysing action via cross-system health leadership. All of these share a common barrier of competing priorities of senior and political leaders, where health may not always be at the top of the agenda. And how is this manifested in mayoral regions across the country? Well, in the West Midlands, the combined authority made a strategic commitment to take an organisational HiAP approach in their regional health inequalities report, which has meant HiAP became a deliverable for the organisation. And then in South Yorkshire, the mayor made the ambitious commitment to become the healthiest region in the country, which prompted a strategic shift in the CA's narrative, particularly around the work and health agenda. Moving on to the second part of our toolkit, opportunities for action, which focuses on identifying opportunities for HiAP action. We feature the following 8 commonly devolved functions with the opportunities they present to improve health and reduce inequalities bullet pointed underneath. So we've got economy, skills, employment and adult education, transport, housing, environment and place, health and social care, arts and culture, and police, crime and safety. We know the ever-evolving devolution landscape, and this is by no means an exhaustive list. Within each devolved function, in this case economy, we explore the opportunities to improve health and reduce inequalities. So good work, inclusive growth, income maximisation, for example, as well as the specific levers within each one that are available to mayoral regions to drive action. And then this is complete with case studies of different ways mayoral regional authorities have deployed their powers and levers to improve health and reduce inequalities. The purpose of this part of the toolkit is to generate ideas and support mayoral regional colleagues to identify the opportunities for HiAP that are most relevant to them. Moving on to part 3, developing strategy. So this provides an overview of the types of goals and methods that have been used to strategically progress the HiAP agenda in different regional contexts, supporting mayoral regions in the process of strategy development for HiAP. The 3 approaches we examine are approach A, building an organisational mandate for HiAP, approach B, prioritising opportunities for action, and then the final one, embedding HiAP as part of organisational culture and ways of working. Within each approach, we break down the possible activities a mayoral region may take and also include case studies as seen on screen to provide illustrative examples of strategic HiAP goals and implementation, looking at the objectives, the actions taken, and then the subsequent impact this had in each case. The final chapter of our toolkit, part 4, capturing progress, is a framework to support mayoral regional authorities to reflect on how the purpose, audience, and level of HiAP activity influences the monitoring and evaluation design process. So we ask the user to consider the following questions in their unique context without being prescriptive. So this would be, what level of evaluation would be most useful to you? Is this at the organisational level or more of a programme or policy level or a combination of both? And then also, what kind of outcomes do you want to measure? And then this will be based on, what is the purpose of your HiAP monitoring and evaluation? Who is the audience for the evaluation? And then are you trying to evaluate the processes or the outcomes? We also provide examples of how these considerations might be used to construct a theory of change, which can help to articulate how planned activities will lead to desired outcomes, outputs and impacts, as well as facilitate consideration of complexities and dependencies that can affect the success of HiAP initiatives. So just on screen are a couple of examples of the organisational level evaluation and then also a programme or policy level evaluation. As mentioned at the start, we have also developed 2 complementary self-assessment tools to support the adoption and implementation of the toolkit into specific contexts. The first tool is essentially an audit of the organisational and structural assets for HiAP success. The user is asked to RAG rate each underlying enabler within each pillar, and this creates an overall score that can be tracked over time. This is a useful exercise for developing a HiAP strategy and can be part of your monitoring and evaluation. This tool is also flexible in that it can be used either organisation-wide or within specific portfolio areas as part of cross-sector collaborative planning. And then this is the sort of output you could expect to see from the tool. The second tool is focusing on helping the user to prioritise opportunities for action as outlined in part 2 of the toolkit, based on factors such as organisational capacity, population need, and then political mandate. So what we found in our research is often HiAP is about knocking on open doors and really trying to avoid spreading motivation for action too thin, which this tool will hopefully support. So thanks for listening. This was a brief overview of all aspects of our HiAP toolkit. I will now hand back to Alice to discuss the next steps.
Great, thanks, Tom. I should have said, just picking up and comment in the chat, this resource has been developed with lots of input from both combined authorities, and also the LGA have got a toolkit for local authorities on HiAP. Obviously, our toolkit is for a different level, so the regional level using different levers and powers, but there's lots of learning that's been exchanged in that regard as well. So just a quick note on next steps. So for the next year, we're going to be delivering engagement sessions and workshops using this toolkit, kind of trialing it and seeing how it works, and then capturing the learning from how it's working in different regions, and also evaluating the toolkit. So if there's any regions here who want to discuss hosting a workshop potentially, then do contact Claire, who's our delivery manager, and her address is there, but the slides will be sent out as well afterwards. So now I'm going to hand over to Mubashir and Jen, who are going to talk about some reflections from thinking about how to use the toolkit in their areas, and also specifically around the kind of devolution landscape and how there's kind of increasing opportunities for regions to contribute to health and reducing inequalities given the current policy landscape. So I'm going to go to Mubashir first. I might take the slides down now, because Mubashir, you're not using slides, are you?
No
Great.
Slides needed. So thank you, Alice, Grace, Tom, for the work. The Mayoral Regions Programme obviously has been introduced, and disclaimer obviously that Jen and I both sit on the governance board on the SRO for the programme. So if I praise the team for the work that they've done, I'm a little bit biased. But it is definitely something which is which I feel is quite useful. Health and health policies is often quite a nebulous subject, especially for people who are not directly working in health or public health. For colleagues within public health, it's a term that we know quite well. We understand the impact of wider determinants of health. But that's not always the case with colleagues working in other parts of combined authorities, mayoral regions, or even within local authority. That's not to say that they don't work, they don't do valuable work that impacts on health. They absolutely do, and there's some fantastic examples. But I think there's something about giving it the structure, and this toolkit that's been developed, it's quite comprehensive. For us, as a Mayoral Regions Programme, we really wanted to cater to the different levels of devolution each of our partners was in. So some combined authorities were just forming, some have been within this arena for multiple years, especially some with devolved health powers and some without. And each one of the combined authorities at different level of maturity when it comes to impacting on health and reducing health inequalities, but also in terms of gaining more devolved responsibilities from government. So only a couple of combined authorities had adult skills devolved to them at that stage when we started this. So it's kind of trying to grasp all of that potential and make it useful for whichever level of devolution you might be on, to be able to relate to how you're going to go about impacting on health. So I think the first part very much kind of allows you to look into how you can implement health and health policies, what types of levers you want from a kind of in a sense of influencing policy and being able to get started really. Then you get to part two, which is more about action and how you would take action within each of those areas with practical examples. And I think that's brilliant for people who are starting out, or even for colleagues who are advanced and they can see and learn from each other. Then we get to third part, which is about developing the strategy and how do you go about developing that strategy, and actually, if you do have all of the levers, then how do you take that forward? For us, all of these are quite useful because, again, even once you've established it, you'll always be revisiting it and where you can improve. So for West Midlands, definitely it is something that we are constantly reviewing, especially with the changing landscape of government, with public service reform coming back into fashion. There's a renewed opportunity for cross-government, cross-sector working, and health and all policies is all about that, to be able to intervene early and have an impact on outcomes through prevention. And then the last bit around kind of, how do you make sure that you've had an impact, both in terms of the work that you've done in the HiAP space, but also in implementing a HiAP policy. How do you know you've done it well? So I think, taking that approach, like I said, it's very, very comprehensive. The tools then that you have, that you can kind of self-assess where you are, rag rate yourself in terms of your readiness for HiAP or how well you're doing HiAP, again, is something that we're quite looking forward to for continuous improvement for ourselves. So I think, all in all, I would say it's a very comprehensive and very practical tool, and actually breaks it down for you to be able to use. Although the audience, as Alice mentioned, is the Mayoral Regions Programme or Combined Authorities and Mayoral Regions, it is equally useful, I believe, for local government and local authorities, as well as for voluntary sector organisations who might be looking to I suppose, kind of have an impact through one or multiple of those levers, and working with those partners to be able to do so. So I think from our perspective and West Midlands, it is very, very useful. And from the Mayoral Regions Programme perspective as well, I would say, I think it's a tool that's going to be quite handy, and it is something that the governance board had wholeheartedly sponsored and wanted to see the results of. So we're quite grateful to see the outcome come out. I'm going to stop there. I'm going to pass it to my colleague Jen, who sits on the governance board and as well. Jen, are you on the call yet?
Yeah, hi. Afternoon, everybody. My name's Jen Connolly. I'm Associate Director for Improving Population Health. I've got a joint appointment between West Yorkshire Integrated Care Board and West Yorkshire Combined Authority, with the kind of task of looking at how we can really support the Combined Authority with their ambitions around determinants of health. And so this work, the toolkit that you can see, is such a helpful framing for activity that we've kind of got going on in West Yorkshire. And I think the real sort of added value of something like this is it brings together all of that learning, because it can be working away in West Yorkshire, have conversations with colleagues across the country, but to be able to put that together in one place with a framing around it that really helps you at different entry points, I think that's really important. As Mubashir said, different combined authorities having different levels of maturity, you're going to have different opportunities available to you in how to take this work forward. So I think the toolkit having that ability to kind of dip in at different stages and look for those different opportunities is really, really helpful. From my perspective, a few key things really. This is absolutely there to support rather than to tell how, and there are examples in there, and there's some really, really good learning. But what we found is that there are many ways to do this. There are many different approaches, and having that kind of that overarching framework just gives you some of that those ideas about how to get started. It's really key that it does relate to the roles of the combined authority, because we know there are great things out there in relation to doing health and health policies in local authorities and at national government, but we thought this was a really kind of unique part to add to that. that family of resources that really speaks to those combined authorities. It's really important for me when I'm working in West Yorkshire that I have those connections with our local directors of public health, and we think about how this adds to the whole, but seeing that unique opportunity to work in that way. I think it's really timely as well that we have a toolkit in this space, given that the English devolution bill does talk about a bespoke duty for combined authorities around health improvement and reducing health inequalities. We're yet to see the detail of exactly what that will be and how that duty will translate. But having a toolkit like this that really kind of sets out what that could look like, how combined authorities can take that forward, I think there's going to be increasing interest in these sorts of approaches as that comes into play. And then just on kind of future devolution opportunities, what you can see in the part 2, those different current opportunities set out, but we know there will be sort of add-ons to this, and it will evolve as we go forward. Already with the kind of conversations around spatial development strategies, they're going to have a health and health inequalities component. What does that going to look and feel like? How do we learn from each other on that? So I think it's a fantastic resource that really has helped frame things for us. And I think the other thing to add is having the backing of the Health Foundation, this being done in a sort of a separate way that brings all of that learning together. It's something that then we can really bring into our organisation as another voice in this space that helps us progress on things. So having that slightly external, not scrutiny, but that slightly external expertise, voice and perspective can really help organisations see, oh, this is important to many people, and gives us the kind of framing for that as well. And I'm happy to speak more about the kind of West Yorkshire experience as we get into questions, but it'd be great to hear from others. Thanks.
That's great. Thank you very much. Really good to hear, Jen, about West Yorkshire, but also Mubashir about West Midlands, to see that practical application being discussed. Thanks to Alice and Tom. Thanks too for Grace for posting the link, and also saying that we will have the slides available if anyone wasn't able to see them during the presentation. Really good, really useful, and lots of good questions coming in. So I'm going to invite people to come on screen, come off mute, and ask a question, although I think it was Rachel highlighted that she couldn't do that, and I'll ask you a question for you, Rachel, when it comes up. But I'd love to go back to a comment that Paul Clark made. Paul, are you able to come on screen just to make that point about popularity of HiAP?
Yeah, so hi everyone. So I'm Paul Clark. I'm a public health specialist working in a local authority, so Kent County Council, and I'm involved with the LGA Health and All Policies Network. It was just a comment really around sometimes I found the concept and approach around health in all policies perhaps more challenging to convey within the public health team than outside. I've often found it easier to talk about wider determinants, health and all policies, that kind of approach outside, because I guess we're very used to in public health kind of looking at the evidence and then putting a service or something in place following the evidence, whereas a lot of other parts of local government are used to on a daily basis that multi-sectoral working, and I think that concept can sometimes be a bit more challenging to get. And when I've spoken about it with colleagues, they're like, well, what's the evidence behind taking this approach? And of course it's very hard because it's quite nebulous to kind of talk about that.
Really interesting point. Would anyone from the MRP team like to pick that point up?
Maybe I'll just reflect on that one. We have had a lot of conversations about terminology around HiAP, and I think the word it's useful as a concept because it is just a short acronym that people know because the WHO use it. But actually, it can be really off-putting for people because we've talked about this idea of kind of like health imperialism, presuming that health is a more worthwhile social outcome than other social outcomes. And I suppose really when using the toolkit, it's really about addressing social and health inequalities, and they're so interlinked that kind of in addressing social inequalities, you're also addressing health anyway. So we're really not, it's not designed to kind of promote that idea that it's health is more important than other things, but it's really just using that as a term because it's easy to talk about and because it's internationally recognized. But I think there'd be lots of ways in which talking about this agenda in certain areas might be useful to use other kinds of other terminology. So I think, you know, things like inclusive growth allude to some of the same aspects as health and health policies work does. So it might be a kind of local discussion about how to frame this concept of capitalizing on broader determinants of health to improve health outcomes or improve social inequality. What's more suitable for that area, given the kind of conversations that are taking place.
Thanks, Alice. I've not come across that term health imperialism in that context before. That's really interesting. It is something that we are aware when we're pushing a HiAP approach of that being an issue, even if it's not even termed that way. But that's really interesting to hear that. Andy Turner, I know you said that your point was probably addressed by Jen, but I know you're a man not short of an opinion. Would you like to come on just say something about HiAP and the different levels of devolution that are coming through?
Yeah, hi Alan, and hello everyone. I know if you're on the call. Yeah, so first of all, just on health and health policies as well, we had some of the discussions in previous roles as well, and I came to the conclusion it doesn't really matter what it's called. It's about the process of just making sure that you consider other things alongside the kind of narrow topic areas and unintended consequences and everything. So any tool that helps people have that broad thinking, I think, is useful. So Jen did mention this almost as soon as I pressed enter about that the tool can be useful across kind of, you know, the different levels of devolution of combined authorities. But so I'll change my question a little bit and say, actually, I think it can be useful over lots of different organisations. I think a local authority could pick this up as well. And even if it needs adapting slightly, you know, it's less a toolkit in terms of here's a checklist to follow, and more just a way to encourage that broader thinking, isn't it? So if you're going to build a housing estate, use this toolkit. If you're going to build a new road, use this toolkit. So is that even a question? I think I was just commenting.
No, that's a really interesting point. Can I just add something to that, which is the next question as well? And then Alice, if you'd like to come in, or anyone else from the team, because Andy, you just mentioned health impact assessment there, and Rachel posted a question, which is, how does this fit in with the health impact assessment and the approach that you'll be familiar with there? Alice, Jen, Mubashir, anyone else, would you like to pick up Andy's point about it being appropriate even in local authority level, but also just that relationship to health impact assessment?
I can go for that one as well, just because it's a kind of toolkit, and then I'll hand over to Jen. I suppose there are, you know, the LGA toolkit has been designed specifically for local authorities, so I think that would probably be the primary tool, but I would say, and this one has been designed for combined authorities, regardless of their level of devolution, but with specific levers. So maybe parts 2, 3, and 4 are more relevant to them, but part 1, I think, is definitely their kind of general principles around enablers and barriers, and I think that could be useful for anyone who's thinking about health and health policies. Just on health impact assessment, we actually talk about those in the toolkit, because that's a kind of way, it's a kind of a way of introducing an organizational process that kind of reinforces a health and health policies approach. So if you were doing a kind of transport intervention, you might do a health impact assessment on that to kind of understand the health and social impacts of that intervention. So it's it's part of a kind of health and health policies approach, and we've talked about how different places have used health impact assessments to kind of support a health and health policies way of working within the organisation. I'll just pass over to Jen, because I think she's going to add something on the first point.
Yeah, thanks. Hi, Andy. It was just to sort of really pick up on something you said there around the way it can be used and the kind of the framing of it. And, you know, I remember starting in this role, sort of, setting out my stall was everything the CA does has an impact on people's health, whether we like it or not, essentially, whether you choose to sort of think about that, whether you choose to measure that, whether you choose to act on that. And I think this is just giving us some of that framing for those wider discussions in the way you set out that kind of think about this when you're doing X, think about that when you're doing Y, and so on. And I think the point about it being used more broadly, absolutely, this is a kind of a way to create the conditions, if you like. It's the kind of, how do you get your organisation ready, thinking about this? What are the types of approaches that have worked? What are the types of things to consider when you're taking that on? And then health impact assessments being more of a tool for helping you think through a particular intervention or something like that, rather than the way to address this. Because as we know, often people see things like health impact assessments more as a burden than an opportunity. And this is more about creating the background environment for them to be used well and to be the importance of them recognised, I think. So I think that's the way I see these playing together.
Thanks, Jen. Mobisha, did you want to come in?
Yeah, I mean, I think I'll just echo. I mean, it's great to see you, first of all, Andy, and thanks for raising that. Obviously, this is, as I mentioned, I think this is a tool, yes, designed for the Mayoral regions, but I think it's absolutely applicable to any organization that's looking to undertake a HiAP approach. And HiAP, again, going back to the name thing, it's recognizable for people in public health, but not necessarily called the same thing in other parts of government. So it's great to hear that it's called Health Everyone's Business, or some other names. But like I said, I think it's this particular toolkit is making it into a practical and usable type of a product that, if you were looking at just thinking about where to get started, it gives you something. If you are already implementing it and you want to learn from other areas, it's got the examples in there. If you want to reassess yourself as to how well you feel that you've implemented it, it allows you to do that. So I think in that way, it is quite comprehensive, but not every part will be relevant to everyone. But it may be that you are able to connect to some aspect of it because of the breadth that it covers. I think it's quite usable.
Thank you. That's really helpful. I'm going to take questions from the people who've got their hands raised, then I'll come back to the ones that are in the chat if we've got time. Jeff, go ahead.
Okay. Hi. I've got a great personal interest in the word enforcement, which obviously links to the law, and obviously every area is going to have the same law, probably. And then I'm thinking of discontinuous interactions, and school exclusions are a great interest to me. 61% of the male prisoners in the UK have been excluded from school. Their lifetime costs to all services is around £450,000 each. And obviously we're processing lots of those people through various arrangements with social care, housing associations, and various rehabilitation work. And it would be great if a HiAP's approach could find a way of understanding that cost chain and try and have an influence on school governors, for instance, in reducing the number of school exclusions to the level in Scotland, which is nearly zero. So it's managing all that activity, which is disparate between different organisations, all of whom think they're doing a good job, but in reality are causing us massive costs. And the costs to prisoners is very high in terms of mental health care, which falls directly in the health sector.
Okay. Excellent, Jeff. That's a lot of issues raised there. Thank you for bringing those points up. Would anyone like to pick up the points that Jeff was raising?
Yeah, I can start off, and if anyone else wants to add anything in, I think that's a really important point. And I suppose in terms of, there's lots of ways you can think about HiAP at different levels, so local authority level, school level. I suppose for the regional level, the big thing that we've drawn attention to in the toolkit is around policing as a, you thinking about policing with the health lens, and lots of regions have done this with these violence reduction units, and that's using a health and health policies approach at the regional level to think about the links between social disadvantage, exclusion, wider social disadvantage and crime. And there's a few examples that are outlined in the toolkit that might be helpful to think about, but not necessarily specific examples, but the principles behind how those VRUs have been designed. And they're very evidence-based, they've been evaluated, and there's been really good outcomes associated in where they're working.
Yeah.
Thanks, Alice.
Okay.
I know there's more that we could get into, Jeff, but I just want to get through. There's quite a few people who've got their hands up. If you don't mind, I'll just bring in another point. But please do come back in again if there's time at the end, Jeff. Tom Lloyd-Goodwin. Hi, Tom.
Afternoon, everyone. So yeah, Tom Lloyd-Goodwin, Deputy Chief Exec at CLES here. So yeah, just for context, we're also working with the Health Foundation and the King's Fund on a complementary project looking at the impact of devolution on health inequality. So working very closely with Alice, Claire, Grace, Mubashir, Jen on this. But yeah, I was just, and it's a fantastic piece of work. It's a brilliant resource. But I was just wondering your thoughts on, I take with the recognition that different places are at different stages in their devolution journey. But are you agnostic about where places should start with this? Or do you think, oh, actually, maybe it's that particular employment intervention, or yeah, you could really be doing this with transport? And I'm thinking particularly about those new strategic authorities that are going to be coming online as a result of the devolution white paper. So yeah, I'd be really interested in your thoughts on any of that.
Grace, were you going to pick that up?
Yeah, Sean, it is a good question. I suppose what we have tried to do is to design it for as many different regional contexts as possible. So thinking about mandate, organisational structure, where the combined authority fits within that wider system, what their relationships look like with other key organisations who influence health. We would suggest starting with understanding structural and organisational factors for taking a health and all policies approach, but actually, thinking about that pushing on open doors approach, it might be more suitable to think about, right, we have this opportunity coming down the line to do something around employment and health. Let's have a look at the toolkit to see what other regions are doing in this space and to understand how we might be able to advocate for doing something differently or for working through it in a more systematic approach.
Jen.
Yeah, just to build on what Grace has said, really, I think the resourcing for this tends to be very small in combined authorities, the capacity to do any of this work. So I think what the toolkit enables is you to sort of see the whole and then look for where it best applies to you in your context. And I think that's what could be really helpful is not seeing it as it's not linear, as in you have to work through it in order, but it gives you a sense of how you can build momentum. But there are entry points along the way. If something, just as Grace described, really, if something happens to be the driving kind of strategy for your region, that's possibly where you're going to get most traction and ability to influence. I think it's the art and science thing again, isn't it, of public health is kind of using that framework, using that toolkit as this is a really kind of strong guide, but you're going to have to use that intuition to know where to maximize it for your area as well. And I think bringing those two things together should enable that limited capacity to go a little bit further.
Thank you. Thanks, Tom, for the question. Jenny.
Yeah, so I'm Jenny French from the East Midlands Combined County Authority. Just at sort of the brief glances I've had a look at the toolkit, I think it's really, really useful. I suppose my question is that at the East Midlands Combined County Authority, we're doing two things. One is that we've got an Inclusive Growth Commission that sort of looks at a lot of the similar pillars of sort of involvement. And it's also the single assurance framework is the other thing about how do we actually embed the two in there. So I suppose I'm not wanting an answer right now, but for me, it's how do we make sure we align all of these, because almost the direction of travel we're looking at going is almost how do we pick this up as part of that single assurance framework, given that we've got lots of other things that we want to make sure are included in our policy sort of basket. Although I notice in the toolkit almost a lot of the same things are in there. So it's just, some of that explanation, I suppose, going forward, and it's not maybe for today, but it's a conversation really useful to have about how it links into that single assurance framework, but also the Inclusive Growth Commission activity that we're doing with the RSA. Thank you.
Good point, Jenny. Anyone like to respond?
Yeah, I mean, I think, Jenny, it's great to see, obviously, the Inclusive Growth Commission. You have probably one of the brainchild of that kind of movement, Claire Spencer there now. So she was influential in how we implemented it in West Midlands. And we often say here in WMCA that the way we WMCA do health and all policies actually is through inclusive growth. So you're right. There's absolutely similarities, and I think we capture that in the toolkit. And similarly, with the SAF, it's kind of how do you embed that in your governance processes and your assurance processes. And again, that's slightly kind of parallels to the HEQIA implementation and how that's been done. So again, I think you'll draw when you go into the toolkit and you'll be able to kind of see the examples and similarities. So I think less focused on what we call it, but more useful would be how it applies to you in your context. And I think it caters to different contexts for that reason.
Thank you very much. I'll just come back to your comment in a minute, Geeta. Meantime, can I move on to Jack Newman? Invite Jack to ask a question, make a comment.
Hi, thank you. Yeah, Jack Newman, Research Fellow at University of Bristol on the TRUDE project. This looks like a fantastic resource, and congratulations to everyone who's been involved. My question is about what the messages are for central government from this, and whether there are any. I mean, there's the English devolution agenda with its focus on the strategic authority ICS relationship, its focus on the public health duty. It also talks about HiAP in the white paper, though there's not a huge amount of detail. At the same time, there's the government's health mission, commitment to close regional health inequality gaps, and the mention in the manifesto, again, light on detail about social determinants of health. So are there any kind of broader lessons that arise from this toolkit, do you think, for central government as they think about the English Devo and the health mission agendas? Thank you.
Great point, Jack. Who would like to respond?
I'll get it started, and I'll co-opt Jen to come in as well. I think the conversations around what will come from the devolution white paper are quite lively at the moment, and you're right. There's not much detail in terms of what a health duty will constitute, although there's mentions of focus on wider determinants of health and health in all policies and reducing health inequalities. All tied up into one. What form the final actual duty takes is going to be quite interesting. Will it be different to what was just given to East Midlands or has previously been given to Greater Manchester? So I think we're all kind of waiting to see how that forms, although some of us may be part of those conversations to try and help shape it. This toolkit in particular could be useful in that sense, as again, less focused on kind of the directive of the word. Is it just about implementing HiAP? No, it's actually, there's quite a few lessons to be learned. So if you are a new combined authority or a new strategic authority that ends up having a health duty, but you don't know where to start, I would suggest, part one of this toolkit would be a great way to actually look at how do you approach it in the first instance, to start thinking as an organization of how you embed health across the piece, with or without a duty. And then if you actually have specific levers, as most combined authorities or mayoral regions will, then you can look into how others have actioned it, and you can go forward. So I think the health duty conversation is very much going to be contextualized with each combined authority and each mayoral authority or strategic authority in terms of what powers they currently have or which ones they envision to want to have going forward. So I think, yeah, it is going to be quite useful, I think, this tool for any organization that ends up getting a health duty. Jen?
Yeah, I think a couple of reflections. I think the duty offers an opportunity to hardwire something in, doesn't it? To say you have to do something here. And this, because to date, bar the couple of examples that Mibsha mentioned, this has generally been done more through intent and willingness, and that it's not been hardwired in that way. I think that duty does present that opportunity, and I suppose my reflection would be then, what's the opportunity to hardwire this in across government so that we get that, the health mission has to think both about the kind of we heard early on the kind of health service being seen as an economic development department, how are other departments seeing themselves and their contributions to delivering the health mission? So I think there's a kind of, it gives you that chance to sort of think about the two-way street in all of these linked activities. So I think there's some learning there about how that could be looked at across government to see that impact, and the join up, the sort of cross sector, but also you can think of that as cross departmental join up that's needed to deliver the outcomes that we want to see in this space.
Thanks, Jen. Thanks, Mo, for sharing. Really good point about influence in central government. Barbara Gray, would you like to come in?
Yeah, I am founder of a Black-led infrastructure and catalyst organisation in South East London, which was formed in response to COVID-19 and the disparities in health outcomes for Black communities in particular. And we are in a local authority area that has the largest Black population in England. So, and health inequalities is something I've been focused on through, and my context actually is economic development, interestingly. So I was quite interested to kind of hear that in terms of how do you grow a local economy with the population that you have, and equity's got to be the heart of it. So I think I was thinking our role is to grow our Black third sector because they're very significant. And in, like you say, going across all the areas that you could imagine, and even some of the things you wouldn't even think that they would connect to, and in very cultural and creative ways of doing it. And I just wondered where, what opportunities there are, or where is the space for voluntary and community sector organisations, and specifically Black-led organisations who are doing some outstanding stuff and completely outstripping a lot of the mainstream stuff that's being commissioned by many departments across children, young people, everything. And how we can use this to actually change the status quo, because we get these things, and I've been working in this area for some long time, and it all sounds good, but when it comes down to it, and we kind of are there to help to deliver the solution, the status quo wins every time.
Thanks, Barbara. Really interesting points you've raised there. Who would like to respond first?
I can maybe give some thoughts, and maybe Grace or maybe Sharon and Dan want to add things. I suppose we've talked about the voluntary and community sector in the toolkit as a really important way of health and health policies working, and there's some interesting case studies about where different regions where that's worked really well, so they might be worth looking through. And there's also some case studies on how combined authorities have addressed ethnic disparities in their regions, and just kind of gaining the evidence and data around that as an important first step, and then how those have been considered as like a really core social inequality that needs to addressing potentially through a health and health policies approach. There are a few case studies around that, which also might be worth having a look at. I don't know, Grace, if you want to add anything.
Yeah, I think just to build on what you said there, Alice, it is something that we highlight as imperative within thinking about those organisational and structural elements to health and all policies, building political mandate, building that mandate with members of the community, different organisations to help define how and what the combined authority should be doing across different policy spaces. As well as highlighting it as much as possible as good practice in the case studies that we draw on for thinking through how action can be taken across a range of different policy spaces.
I think we talk about this in terms of the engagement as well. So the kind of inclusive engagement approaches that combined authorities are developing, have developed, will continue to develop, and how that informs planning, policy making, commissioning, and that relationship with the VCSE has to be developed in different ways by each combined authority, because it's about the local infrastructure there and the offer there. So I think understanding your population and understanding the kind of network and kind of lay of the land with the VCSE, I think is really, really important in that way. But thinking about that and those different opportunities for engagement, as well as then bringing that intelligence through into the strategy and policy making, and then ultimately into how we deliver different interventions and commission things across. I think that's key, and that there's a thread throughout.
Thanks, Jen. I'm going to move us on quickly. I think we've probably only got time for one more question, so apologies, Jeff and Ruth, we're probably not going to get back to you. But Caroline Jackson, would you like to come on?
Hi. Yeah, I think it's been a great discussion, and my question was about really links, I think, quite a lot to maybe what Barbara was saying. How do we map? How does the toolkit make sure we've mapped out all the things that are really happening on the ground? Because in a way, the mayoral authority, I'm a leader of a district council. We're looking to be thrown up in the air. We've got fantastic relationships. We've been part of Changing Futures, so we have taken the health duty rather than being given it, because we've understood and learned, and we've particularly learned from lived experience, and we've passed that. You know, that's gone across housing, it's gone across all areas of the council. Well, not quite all, but we're pretty pushing. How do we manage to hang on to that through local government reorganisation, and can the mayoral authorities, you know, can it manage to help that happen? Because I'm really worried that we will lose that powerful sort of grassroots local part in this, and I don't know, that those fractured relationships mean less good outcomes when it comes to really challenging what we need to do for the social determinants of health. And I think Barbara's challenging, and I think Jeff was, you know, you've got to actually look very broadly if you're going to make a big.
I think Caroline's frozen there for a minute, but I think we were getting the gist of that. Would anyone like to respond as the final word?
I mean, I think I'll just say, obviously, you know, engagement with communities is something, you know, we think it's best done at hyper-local level, obviously, but there is value of defining what useful community or meaningful community engagement can be at combined authority or strategic authority level. This, again, toolkit is, at the moment, the way we've laid it out is something that we want to now test as the next stage with a couple of combined authorities. Certainly we'll test it in West Yorkshire and West Midlands, because we were the ones requesting it, but across the 10 partners on the Mayoral Regions programs, I think we're going to test it in each of the areas that's interested in wanting to do so. And I think we'll have more learnings coming through at that stage in terms of how practically this works, especially when it comes to the different levels. So whether it's be engaging voluntary sector communities and or with local authorities and other partners in the region in terms of how well together we can implement HiAP in a place. So I think there's Caroline, just kind of coming back to your question, it absolutely recognize the importance of engagement at the hyper-local level, but it is about learning how we take that and apply it to a combined authority or strategic authority level is going to be critical for us going forward.
Thank you, Nubisha. That was a very considered response. And we could clearly go on for much longer, but we do make a promise that this will be an hour-long session. So I'm going to draw it to a close there. Thank you so much for all the questions, but also the interactions on the chat facility. And I could see that Grace and colleagues were offering to follow up in various things. Other people were offering other links as well, which is always good to see. And thanks very much again to the Mayoral Regions Programme team. Also to Jen and Nubisha for presenting and also answering those questions. That's been an excellent session. We will have a recording of the session put on the Health Equity Network, and as Grace was posting, there were links to the toolkit in the chat, but it will also have that on the Health Equity Network too. Do join us again in a month's time, end of April, when this session will be on Marmot Places, and hope to see you all back for them. Thank you very much for your contributions today. Have a good rest of the day. Thanks.